Welcome back into Talking Fitchburg, everybody. Today we have Agrace Hospice Care from down the street. They're here. They come here monthly. And today we get to meet Brenda Gonzalez from Agrace, newly hired with Agrace, and glad to have you out here today. And what we're going to be talking about is diversity at Agrace overall. So thank you for being here. We really appreciate it.
Thank you for
hopefully you like the set and whatnot, and not too scary here, right?
I'm a little nervous, I should confess, but definitely thank you for the invitation. I think it is just so important to talk about diversity, especially in the things that are happening in our city, in our county, in our nation. So I think that the more that we understand diversity, the more we are going to be able to feel more comfortable, and hopefully we can make it through some of the hard times that we are going through.
Absolutely. And Fitchburg's we were having a conversation before here that Fitchburg is a very diverse town, so great spot to start having the conversation here. So let's talk about why Grace is interested in diversity.
Absolutely. Well, I think that Grace has bumped up the efforts in terms of having now a diversity manager, which is myself. For about 5 months, I've been in my new role. But Grace has a long history of trying to understand diversity, trying to understand the changes in our community in terms of cultural backgrounds and other pieces of diversity. Grace, as you know, we work, and our mission is on end-of-life hospice and palliative care services. So how to really explain to people in general, not only just to diverse communities, but also in general, what that means, the services that we are providing. Sometimes it comes to at a point that people want to understand it when they're facing the situation, either patients or families facing end of life. So it gets a little bit complicated. So can you imagine having a barrier, like a language barrier, or not understanding the system? I think it gets even more complicated. So I think that Grace, again, for over 10 years, has made some efforts in trying to get more understanding around diversity. So a long time ago, we had someone at Grace that about 10 years ago or so that was bilingual in Spanish, provided some spiritual and grief counseling or something to that effect. It was a part of the volunteer services. So that evolved into really having someone that needed to be in charge of diversity or the diversity efforts and plans. So I think that's how they changed to, let's have someone dedicated, instead of bringing in some of the people that seemed that understood diversity and that were able to really either train our staff and to do outreach to the community. So that's how kind of the starting point of Grace and focusing on diversity.
It's pretty good stuff there. What types of things are Grace doing to promote inclusiveness, diversity with the employees and the patients?
Absolutely. So I think that, kind of going along with the same, explaining a little bit of the history and why Grace is interested in diversity, we really thought about how, again, that will look like someone in charge of diversity. But the conversation actually in the city, not only in Fitchburg, but in Madison, in the county, really started to turn into more like social justice type of conversation. How to make sure that the healthcare system was part of that conversation was a little bit more complicated, because we see it as just part of a service that is provided to all, but we really don't realize the disparities that are happening. So I think that as Grace was becoming more aware of what the plans that we had for diversity and inclusiveness, we really started using that language. What does that mean to be an inclusive organization, and ultimately how to be a more equitable organization when it comes to not only our the information that we provide to our community, outreach to the community, but also internally. We really have to look at our staff, how we look. Do we look like the faces of our community? And what does that mean if we don't? And I think that because of that, we are making efforts in making sure that the staff, long-time staff that we have at Grace, feel comfortable bringing kind of like their whole selves to the work, and so I think that because we're creating that type of environment, we are attracting more diverse professionals, right? That want to work with a Grace. We have a great mission. You can't go wrong with that mission. I think that everybody is committed to providing the best service that we can to families and patients that are going through and facing end-of-life situations.
How has Grace participated in equity conversations locally in Madison?
Absolutely. I think that, so as you can see, it's kind of a trend, right? We have the great history, knowing that things were changing, things in the community. We had a different look, a different feel of who we were serving. So very quickly, we realized that we needed to know more. We needed to learn what that really means, not only just throwing that concept of, oh, we are diverse, or we want to be more inclusive. We really wanted to have a closer understanding of what was happening. If we can feel it in our organization, if we can see that other communities are trying to access our services, we realized that we needed to be part of the conversation. We really needed to see what was happening in the city. So part of my role and part of my priorities are to do outreach in the community and to connect in the community. There's nothing better than to be at the table when conversations are happening. So sometimes you think, well, at Grace, how is that hospice and palliative care organization really interested in spending some time in the community at a table talking about diversity or cultural competency trainings or social justice advocacy that is happening in our city. But absolutely, we are partners, we're neighbors. We want to make sure that we connect with our neighbors in that way. We want to understand, we want to explain who we are, how we are providing those services, and that we are open to all. I think it is really important to not only say it, not only in a way have the logistic piece, let's say provide interpreter services for our patients, let's say one of the barriers, right? But also to be part of the changing times that are happening in the city. So one of the things that I can tell you that we are doing and that we're very, very proud of, we are part of a cohort of organizations that is working directly with the YWCA, creating more equitable organization training. We are actually, were selected to be part of that cohort, 12 different organizations, and I can list some of them, like the Overture Center, for example, Unity Health Insurance. So we are very proud to be part of that amazing group of organizations that are really interested in making efforts into creating more equitable organizations, meaning not only for the patients or customers that they may have, but also for programming. For example, I can see how the Overture Center certainly is making really good efforts to make some of that programming, for example, to really attract more diverse audiences. Certainly in healthcare, we are providing many different trainings to our organization. So in any event, we're very proud to be part of that effort. So we are part of the conversations. How do we want our city to look, our county to look? And also we have to keep in mind that we not only serve Dane County, but we are in about 10 different counties in the region. And we are excited to be able to say that we are bringing our expertise as palliative care or hospice services, but also to be able to say, and we welcome everyone. It doesn't matter where you are, if you're part of that service area, we're going to be able to reach out to you to either have, if you need to, come to our facility, beautiful facility, as you probably know, great location, but also be able to go to your home and really provide the services that you need the way that you need it and your family needs it.
Brenda, it's a really great conversation to have, and we really appreciate it. I wish we had more time to to dive into it, but I think you gave a good overview of kind of how it all kind of ties together. And certainly a long-term conversation to keep having, and hopefully we'll get you back on the show and we can continue the conversation down the road.
That would be great. If anyone wants more information of our services, the best place is to, of course, give us a call, but also you can go to our website, agrace.org, very easy, agrace.org, and you can get more information there.
Perfect. Thank you so much for being on the show. Really appreciate it and looking forward to having you back.
Thank you.
All right, it's Talking Fitchburg. We'll be right back. Wonderful.
I can breathe.
Wonderful. You did great. That was
Thank you.
a really great synopsis, I think.
Okay.